Yeah.
When you decided to go and start examining the patients, okay? Because at the time, the recommendation was for the patients to stay at home. You had to protect the doctors as well from getting exposed. Why weren't you afraid?
I didn't buy that narrative because I felt if as a doctor for 45 years, I've always known that we get subclinical infections and we get immune to it. If I've got an immunity to it, I can't get infected. There's no way I'm going to get another infection. I, I, I was prepared to die in my rooms because I felt this is a cop out method. As a family physician, I touch patients because that's what people want. During the alpha strain, they didn't get much from me. The mere fact I examined them, they said, Doctor, I feel so good. My doctor doesn't want to see me. He doesn't want to touch me. I feel so disappointed. I've known him for 20 years. They put the phone down on you. And I said, no. And I became confident when I started reading The Masks Don't Damn Well Work. When people would come to me with a pneumonia, Philip, this is and I can say this today because I'm sitting here alive. I'm 75 going on to 76 and I've reversed my age. At another time, I'll tell you how I did it because I was taught wrong in medical school. You know, I found that I was coping well, and I took my own prophylaxis. By the way, we're not going to talk about what it is
Okay.
because I can't sit at home and not do anything and know my patients dying. I felt I'd be letting them down. I went and nothing was happening to me. And I said to them, when they were coming to me breathless, almost keeling over with the mask, I said, take that rubbish off your mouth. No, doctor, I don't want to infect you. I said, bring it on, pal. I need the booster because every time I got natural immunity. When I get the infection, I'm getting a booster. Fauci doesn't know what's boosting. You don't give these things, you get another virus. And I know I had good natural immunity. I've only had COVID about 3 times. They were mild. And I've gotten better. And I was so glad for it. And I had my treatment for it. I had an antiviral and it worked. And I'm still
Yeah.
alive now. I'm doing well.
So
So
yeah,
I
so
examined them.
it
Yeah.
raises some important points, you know. Robert, you have to realize that part of the reason I think, and I'm going to pull you into the situation, say with Dr. Shetty now. So Dr. Shetty, he went and he tried to tell people, similar as yourself, look, I'm trying to help people here. Whilst you may not agree, somebody may not agree, I can tell you from clinical experience, none of my patients are dying. Okay.
Yeah.
And he's trying to share that and he's trying to bring that across to the world. And instead of people listening, he then gets not just censored, but he is they're currently trying to take away his license to
Yeah.
practice.
Oh.
What do you make of that?
I think medicine's gone wrong. I'm an old guy now. I'm disgusted with medicine. I mean, the thing is, I want to see the return of the doctor's individuality and his independence. And I think there's a lot of big cartels involved in this. And I want to see that doctors have the right to treat their patients in the best way that they know, and they will take the risk for anything they do wrong. There should be no interference from government, no regulatory authorities, as long as you can argue. You see, medicine, I'm sorry, is a second army. The only difference is that the army wears brown coats and the medicine army wears white coats. What the boss says you must do. And I'm a rebel. I'm a thinker. I will listen to a professor, but if he doesn't make sense, I'm sorry, I'm not going to do what you tell me to do. Because there are a lot of things they've said. So I think it's a disappointment if Dr. Chetty goes because he's a critical thinker. I have the greatest respect for him, not for many of my colleagues. I can understand people who had a conflict of interest and were captured. But we GPs, we independent GPs, we were not captured. And I mean, I showed the evidence. They saw my videos. A lot of doctors learned from me, and I'm glad for that. But they should be standing up. We need some guts. I think I, more than Chetty, stuck my neck out because I was prepared to die. Because I was prepared to. I mean, I'm an activist. I mean, an activist in a sense, I was opposed to all forms of injustice. I fought for against apartheid in South Africa, especially on health. I felt there must be some dignity, some humanity, everybody. So this was another fight for me, and I was prepared to die for it because I think it is wrong to see our patients die when we are there standing by and doing nothing about it. So I hope that whoever is trying to get Dr. Chetty off the books will have a change of heart, because there's no question in my mind are absolutely wrong, and I'm prepared to debate with them. And I have debated with some of these professors and made them look like ruddy fools, and because it's not their degrees. I have got no respect for their degrees other than for their morality and the integrity and their knowledge. I'm afraid a lot of them are textbook guys. They don't understand the science. If you got anything wrong with COVID, people are finding me somewhere from the. I work in a very poor community, but I have had the richest of the rich coming to my rooms eating humble pie. And to me, I don't differentiate between patients. It doesn't matter about your social status, because for me, COVID became a calling. I'm not trying to blow my trumpet here. If you didn't have the money, it was not a reason for me not to treat you. I'd rather do away with the money than to know that somebody couldn't afford me and lost their lives. And
Hmm.
I think that is where I want to see medicine return, where the doctor has full authority to decide, I will not charge. In America, if you don't charge, you get fired. I don't want businesses to be in charge of my healthcare anymore. I'm sick of them. Through your program, I want to say this: businessmen, get out of my life, because this is a beautiful profession. I've enjoyed it. I want nobody telling me how to treat a patient.
When
Yeah.
we close out now, what is it that you think, based on your experience? And because, as I said, in South Africa, COVID seems to be over because
Oh,
they've
absolutely.
probably
We've got a flu
herd
now. Yeah.
immunity. So they
Yeah.
have herd immunity. But I can tell you that in other parts of the world that are highly vaccinated, they are still having circulating Omicron variants. And the presentations are extremely unusual. They're not presenting with lung disease and so on. So,
Yeah.
based on your experience, then it suggests that people just need to get in the trenches, observe the patterns of disease, and try and understand exactly how it's affecting patients. Any advice to the medical communities?
Well, look, for me, by and large, Philip, I would still think that coronavirus has the pattern of, viral pneumonia and hematology and clotting. And I've given my early signs, and I would think if it's a rapidly multiplying virus, like you would have found with the Omicron, it was extremely infectious, but not so virulent. Is you treat the symptoms as they present. I don't think we need to be pedantic, and each one is individualized. And I think why you're seeing so much of it in the other countries, I think because of immunodeficiency, and that we need to come to that reality. And I think the sooner we wake up to the reality that when you have an infection, a vaccine is not going to save you. I mean, that's XYZ, for heaven's sake. I mean, whatever platform we are in, you've got to use an antiviral. It's better time we come to the party and start saying there is a drug what one can access, use, and treat. But the unmentionable drugs are the ones you must get. It's up to
Absolutely.
you.
And just as
It's up.
a final
Yeah, look.
reminder to the audience, take a look and remind yourself without us saying anything on it. But yes, that's his toolbox that he has used and used very successfully over the years. And what I can say, Robert, is that we appreciate you sharing this kind of information with us. We appreciate you raising your voice. And you did lose your voice at some point with regards to censorship in the past. But the point is that it's only when science can be adequately debated and discussed and challenged that we have an evolution and a growth of science.